Alright, so we're going to go through how to use a glucometer, and first you're going to make sure you have all the supplies that you need. So what you're going to need is gloves, you're going to need alcohol wipe, test strips, a lancet, and also a blood glucose meter or a glucometer. And it's important to remember when you're doing this to make sure that the meter is accurate. That way you get accurate readings and everything is working properly. You want to make sure the test strip codes match that on the lancet. That way you get an actual reading and then it works. And you also want to make sure the test strips are not expired because if they are, you'll just get an error and then you won't be able to do anything with it because you won't get a reading. And then it's also recommended that you wash your hands with warm soapy water prior to this. That way you prevent infection. Most commonly though, like we said, we're just going to use an alcohol wipe. That's the most common method. And if you're doing it on someone else besides yourself, you want to make sure you wear gloves, like also mentioned earlier, to prevent any bloodborne pathogens. So next what we're going to do is you would remove the cap on top and place the needle inside and then place the cap back on. And then you want to adjust the depth of the needle and make sure that you're using a clean needle, one that hasn't been used before. So then you're going to go ahead and clean the area that you're going to be testing on with the alcohol wipe. Make sure it's clean and dry. And then next you're going to, before you prick the finger, you're going to turn on your glucometer and insert the test strip into the glucometer. Then you're going to go ahead and the test site that you just cleaned, place the lancet on it and firmly press against the finger and press down to prick the finger. And then you're going to massage the finger to get the blood to pool up to where you pricked it. That way you can get a reading. And then you're going to take the meter and place the blood pooled on it. And then once you get that, you're going to check the meter and get the reading that you wanted. And so then after all this is done, you're going to clean up everything and dispose properly. So and this is important to avoid any bloodborne pathogens or any infections. So after each use, the needle needs to be changed to avoid any different people using the needle. And you're going to want to pop open the cap, take the needle out, and dispose of it in a sharps container. And the test strip that was used should be removed and placed in a biohazard container. And then you're going to want to remove your gloves in the proper form by pulling one off and then pulling the other one over top.